Emergency preparedness and prevention is so important during these times when pets can be turned away from busy and understaffed animal emergency rooms due to COVID. I personally encountered 2 emergencies in less than 2 weeks with my own pets, and this made me really think about things from a pet owner's perspective. I remember just how important it is to have a plan for emergencies, especially when you're out of town. I want to help you be prepared for emergencies. Stick around and I'll go through some things you can do that can save time and help you be ready in the event of an emergency. I've even got a PDF for you to download to be as prepared as possible. There are 2 kinds of emergencies, immediate and urgent. The first type is akin to 911 in human terms. You're the ambulance trying to get care as soon as possible. And the second, your pet is ill, but it's not an emergency. It's important to distinguish the two as emergency rooms are overwhelmed and understaffed. Here are some examples of 911 types of emergencies in pets. This is when you need the ER right away.
Download our Emergency Preparedness PDF for a list you can keep handy. You can find the link in the description. I hope that having these lists and your emergency plan ready and hanging on your fridge or bulletin board, you'll be able to react quickly and with less stress if an emergency or urgent situation does occur.
And here are some cases where the best plan is to call ahead to try to get care for your pet.
These are also in the downloadable PDF.
But here are my top tips for being prepared. Number 1, keep a list of pet ERs, their proximity, address, and phone numbers handy in your phone contacts, especially when you're traveling. It's important to have a list because you could be turned away from the first one you try. Number 2, call ahead to see if they accommodate you or if they'll reroute you elsewhere. Calling ahead also allows them to prepare appropriately. Number 3, know where there's specialty ERs. If your pet has a heart condition, if they're prone to neurological problems, you want a specialist on hand, so you might want to travel a little bit further for that. Number 4, be prepared to wait potentially hours. Be patient. Be prepared to sit outside in the heat. Bring water for yourself and your pet. Your pet might be taken back quickly, but there's no guarantee, and you may not have access to water or a bathroom. Number 5, pet emergencies are expensive. Look into health insurance. Make sure you have a slush fund in case of an emergency. Number 6, keep a list of all medications and diets your pet is on to give to the ER staff. Bring whatever it is your pet got into with you so that you can show them and they can identify it. Keep pet poison control's number in your phone. Number 7, be proactive so you don't have an emergency to begin with. Keep your dogs on leashes away from cars, snakes. Make sure your dog is secure in the car. Don't let them hang out the window. If you're rear-ended, out they go. And if they fly through the car, you can be seriously injured. Don't let your pet overheat or get hypothermia. If you have visitors, make sure they secure their medications. Don't leave anything out that could be potentially dangerous to your pet, so you need to vet the situation. If there ever was a time to be proactive, it's now. So what if your friends say you're a helicopter mom or dad? But anyway, number 8, make sure you have ID on your pet. Number 9, if you travel with your pet, have a signed waiver with a caregiver authorizing a certain amount of payment if there's a problem. Whoever's taking care of your pet needs to be able to go in, have a method of payment, and they're authorized to seek treatment. So I had 2 recent emergencies with my own pets. One when I was out of town and unfamiliar with the area, and one locally. Make sure you watch my other video about water toxicity. I lived through an emergency with my dog recently and had trouble getting the help we needed. Another urgent medical situation I lived through recently was with my Papillon. He herniated a disc in his back and needed specialty emergency care by a neurologist. I drove much farther, passing at least 3 or 4 ERs to get to a specialty center ER that had a neurologist on staff the next day that could see him. Dachshunds, miniature poodle, longback doggy moms, and dads, take note. If your pet has health issues that are related to its cardiac, internal medicine, neurological problems, you can take a lesson from this as well. You'll want to know what veterinary centers near you have specialists on staff for these sorts of problems. Remember, this is also important to know when you're traveling. Don't forget to subscribe and hit the notification bell so you can know when we release a new video. And for goodness sake, stay safe out there.